CYC is a free channel, presents the Word of God for everyone. Your support will help us to continue the mission. Visit our website, cycnow.com. Even $1 will make a difference.
Hello, and welcome to another season on CYC MD. As you know from our previous season, we met with different professionals and talked about various careers and focused on specifically on the professional field of practice. Today, we will be having a closer insight and focusing on the topic of urology. With us today is our guest, Dr. Ahmed Riskallah.
Hi, how are
Pleasure
you?
to have you. Welcome, Dr. Ahmed.
Nice to be here.
Who is our urologist himself and will talk to us and provide us with many information that we have and questions that our viewers sent us in regards to urology. So to start, if you can just give us a brief background, kind of take us like a journey on your education life, where you went to school and past experiences, and bring us to the man you are now.
Well, after high school, I went to a 7-year BS MD program at the City College of New York, and from there, I went to Stony Brook for the last part of my medical education. And then from there, I did a urology residency. That was 6 years. So 2 years of general surgery, and then 4 years of urology after that. And then I did a 2-year fellowship in minimally invasive robotic surgery. So altogether, it comes out to be a long time. It comes out. It's about 15 years after medical school, after high school. So.
Wow, that is.
But it flies by. I know everybody says that, but it really does fly by. So.
And where do you currently work now?
Right now, I live and work in Westchester County in White Plains. I'm part of Advanced Urology Centers of New York, the White Plains division. So. I
know you also worked a little bit in the Cleveland Clinic.
Yes, that's where I did my fellowship. So I did 2 years there. It was the first year was clinical, so I did a lot of robotic surgery, laparoscopy. I did a lot of stone endoscopy, and then my second year was a research year.
Okay.
And then now I'm back to New York. So yeah.
Well, welcome back.
All right, thank you.
This is your home.
Yeah.
And you mentioned a lot of the procedures, and we're going to be actually focusing and talking more on those procedures later on, though. So I want to ask you, what do you like most about your job?
Well, I like that when I try to fix something, it actually gets fixed, and the patients are very happy for the most part. Someone comes in with a kidney stone, and then you take out their kidney stone. They're usually very satisfied, and they're very happy. And so there's a lot of patient satisfaction that kind of makes your life and your work a lot more enjoyable, a lot easier, because you're seeing that something that you're doing is directly helping the patient, and so that you get a lot of gratification from that. I like the surgeries, obviously. I like there's what's nice about urology is that there's an office part as well as there's a surgical part. So you're not always in the operating room and you're not always in the office. So it's a nice mix.
And as with many careers, there's always challenges. So what would you say is most challenging in your career, or in your profession, in your practice?
Well, I mean, it's a long time for training, for sure. So that's all throughout my 20s and my early 30s, I was training essentially. So it's a long road. In terms of the actual practice, it's the responsibility, obviously. Especially as a surgeon, you're always anything that you do that directly affects the patient.
Right.
So that large amount of responsibility, that obviously could be stressful. But I think you get used to it after some time, and you learn to be careful and to pay attention to details and things like that. So.
And just so we know, what's your daily schedule like? What hours do you start? How's your work schedule?
So usually when I'm in the office, it's usually from 9 to 5 or 6 o'clock, depending on when I finish seeing patients. When I'm in the operating room, I start my day 7 o'clock in the morning, and it really depends on how many surgeries we have that day. Sometimes I can finish at 3 o'clock, and sometimes I can finish at 8 or 9 o'clock at night. So it really depends on how many procedures we have and how long each procedure is and how complicated each one is. So it's variable.
Okay, but overall, I think that's a pretty decent.
Yeah, it's a reasonable. Yeah, I mean, I can't complain. It's definitely a reasonable.
I'm sure before that it was probably.
Yeah, residency was very tough. Long hours. When you're overnight call and staying in the hospital, so that was difficult, obviously. But honestly, it really passed by very quickly. So to the point that you don't even feel that you look back and you're like, man, that I just finished 6 years. It's but during that time, it's definitely difficult. So
yeah, because a lot of people actually say what's challenging for them is to balance their work life with their social life, with their family life, but I guess once that season in your life is over,
right, exactly,
things
and you learn. Obviously, you learn to prioritize. Everybody has different priorities, obviously, but me personally, family is family, and as what family / church is number one. So you learn to always give that priority, and work comes after. Sometimes if you're on call on a Sunday, obviously you can't come to church. So things like that. But for the most part, you try to kind of learn to balance things. So.
Absolutely. Yeah. So let's cut to the chase.
Okay.
A lot of people are wondering, what is urology? So simply, just what is the study of urology?
Sure. So essentially, it's the medical discipline of genitourinary tract. So essentially, pretty much we take care of surgical diseases in relation to kidneys, the ureters, the bladder, the genitals, male genitals, things like that. So, anything having to do with that. So, with that whole system, different things could break down. And so, in terms of cancer, kidney stones, enlarged prostate, things like that, blood in the urine. Those are all things that we kind of see on a daily basis, on a regular basis. So, and we treat those things and we investigate and see why those things are happening. So.
And what age group do you mainly target?
So me personally, I actually see adult patients only.
Okay.
So pretty much anybody from 17 or 18 to people in their 90s. However, there are pediatric urologists that kind of take care of. It's really a reconstructive type of discipline where there's certain defects that some children are born with, and so they're there to kind of fix those defects. Essentially, that's really what they mostly deal with, which is actually it's a very interesting aspect of urology also. But
so you mentioned earlier blood in the urine and other things regarding urination.
Sure.
In a healthy person, how many times would you say is a reasonable time or what is a reasonable number of urinating in a healthy person?
Well, I think it really depends on how much fluid you're drinking that day. And it also depends on how much caffeine you're taking into your body, essentially. So if there's some people that, they drink 3 cups of coffee a day, and so those people are going to definitely produce more urine because caffeine is a diuretic. So you're definitely going to produce more urine. If you're used to drinking a lot of, water bottles and things like that, that's gonna, you're gonna produce a lot more urine. I think it really becomes an issue, especially in men as they get older, when they're waking up a lot at night. And I think that's really the most bothersome symptom that men and middle-aged men, men in their 50s to their 70s and 80s really come in for. And so, I think starting at the age of 30, it's normal to wake up, once a night. Sometimes twice a night if you had a lot of caffeine right before you go to sleep or you've been drinking a lot of fluid. But I think as you get older, some men tend to wake up 3-4 times at night to urinate, and that's not healthy. So there are things that we could do, medications and procedures that we could do to kind of help them with it.
So you mentioned earlier you deal with people with blood in the urine. Should a person see blood in their urine, what action should they take, or what is that, should they be worried, in other words?
Sure. Well, I mean, blood in the urine is never normal. That's never a normal thing. So if you happen to see blood in the urine, then it could be many different things. Essentially, it could be disease of the kidney itself, within the meat of the kidney, you could say, okay, or it could be something also having to do with the ureters, such as stones, or it could be bladder cancer, which is the worst case scenario. And in that, anybody that comes in with blood in the urine without any pain, that especially someone in their 50s or 60s, we always have to rule that out. So it's never normal to see blood in the urine, and if anybody sees blood in the urine, they definitely have to go see a physician right away.
So if someone does see it, first thing probably I'd say emergency room. Like, don't wait.
It really depends on how much blood there is. If they're urinating clots, then yeah, I think that's definitely they should see someone in the emergency room. If they see a little bit of blood here and there, then they could probably wait until their physician, especially if they're not having any pain, they could probably make an appointment with their physician and to just investigate that. And most likely, if they go see the primary doctor, he's gonna refer them. He might do some preliminary workup and then he'll refer them to a urologist. So.
Okay. Thank you so much. We're not going anywhere. We're going to be stopping for a short break, and we'll be back with more topics to discuss with our urologist, Dr. Ahmed Riscal. Welcome back. We are back with Dr. Ahmed Riscal, and to help answer many more of our questions. Thank you so much.
Thank you.
So I want to now touch over the topic of a urinary tract infection, which is otherwise known as a UTI. And we're going to be focusing on that in this half. But first, what does the term incontinence mean?
Sure. Essentially, incontinence is the inability to control the urine and the inability to hold on to the urine. It's never really normal for someone to leak urine, and obviously that could lead to some embarrassing social situations, as you can imagine. It's essentially you can't hold on to the urine. That's what it means. And there's different types of incontinences. We see incontinence mostly in women, okay, and there are really three major types, with a mixed type also. So the first type is really urge incontinence, meaning having the urge that you have to urinate right away and you can't get to the bathroom in time, and then you dribble a little bit or you leak a little of your urine. The second type is what's called stress incontinence, meaning and we see this a lot in women that had multiple childbirth, especially vaginal deliveries, where they anytime they sneeze, laugh, lift something, cough, and they would leak a little bit of urine. Okay, and the third type is what's called overflow incontinence, which we actually more see in men. And overflow incontinence essentially means that you're not emptying your bladder completely, and so the bladder gets very full, and then would periodically just leak a little bit of urine. Okay, and then there's a mixed incontinence, meaning just a mixture of pretty much urge as well as stress, and we also see that in women.
Okay, you mentioned earlier that incontinence is more prominent amongst women than in men. Mm-hmm. Is a urinary tract infection, is that only for women, or can a man also experience a urinary tract infection?
Sure, men could definitely experience urinary tract infections. It's more rare for men, especially men that are younger, to experience that. But we do see it more. If we do see it in men, we do see it more in older men, again with an enlarged prostate. And essentially, what happens is that they're not emptying their bladder completely, and so that urine sits around for some time and gets infected, and that's how they develop a urine infection. So that's really the most common cause of a urine infection in men, and again, it's mostly in older men.
Okay, and what are symptoms of I'm just going to say a UTI, which is short for a urinary tract infection?
So essentially, the symptoms are lower abdominal pain, burning on urination, just a feeling of not feeling well, but it's really burning in the urine, lower abdominal pain, and urgency and frequency, meaning having the urge to urinate a lot and just go into the bathroom a lot. And you could also see some blood in the urine with a urine infection. So that's one of the things we also check when someone comes in with blood in the urine, whether or not they have a urine infection. So.
And what are some treatment measures that are taken when somebody has a UTI?
Well, it's pretty much antibiotics. What I usually do when someone comes in with a urine infection is, I get a history and physical, and if they're having any type of symptoms, obviously, then I would send their urine, send it for a culture, see what kind of bacteria is growing, and I would treat them with antibiotics right there and then. And then if the culture comes back as something that's not sensitive to the antibiotic that I give them, then I would switch the antibiotics. But if someone comes in with these symptoms, I always give them antibiotics, and we'll go from there.
So just now touching on the other topic of kidney stones, what causes kidney stones? I often hear actually some men in my job complaining of kidney stones. So what causes a kidney stone?
Well, kidney stones it's a very painful disease, as you can imagine, and it causes a lot of morbidity, meaning it causes a lot of loss of work, a lot of patients, and there's a good number of patients that suffer from this. And essentially, are there genetic component to kidney stones? Sure, and we do see that it runs in families. There is a specific genetic defect that could lead to kidney stones, and it's called cystinuria. And these patients really form cystine stones exclusively. Okay, but that's kind of a rare thing. Mostly, it's a multifactorial, like I said, but it's really, dehydration as well as high sodium diet, among other type of abnormalities in the urine chemistry. So one of the things that we do when we're working them up is we check a 24-hour urine. We see exactly what the chemistry makeup of the urine is, and we kind of target our treatment to prevent infections, to prevent stones based on what we saw in the 24-hour urine. So.
So how would somebody know that they have a kidney stone attack? What are some signs or things they may feel?
They usually have, if it's a kidney stone attack, that means that the stone is really in the ureter, which is the tube that connects the kidney to the bladder. And usually the sign of that is flank pain on the side that radiates to the groin area. Okay, that could be associated with some blood in the urine, and it's pretty severe pain. Some people refer to it as pain just as bad as childbirth, which you could imagine is very painful. So it's a very painful symptom and disease, and we see it in the emergency room all the time. Essentially, it's very common, especially after the summertime where people are kind of dehydrated all throughout summer, and then that's when they start forming their stones, and then we see them pretty much in the October to December time where they start dropping these kidney stones.
So should someone feel an impending kidney stone attack, what should they do?
If they do have, they're having pain and nausea and vomiting, which you usually see with a kidney stone, go to the emergency room. Okay. Again, sometimes you could pass it on your own. Sometimes the stones are really big that you'll need my help essentially to take care of it. So, but again, I think if you're having this pain, go to the emergency room. Okay.
Should they, in the meantime, drink a lot of water to help pass it through the urine?
Right. So that's exactly. So you drink a lot of water. You could take some pain medication for it. That's essentially what they do when you go to the emergency room. They give you fluids through the IV, intravenously, and they give you pain medication, and they give you other types of medication that would help you pass that stone. So, and they do a CAT scan usually or an ultrasound just to see where the stone is. So,
thank you so much, Dr. Ahmed.
You're welcome.
Thank you so much for answering all our questions. It was really a pleasure to have you.
Thank you. Thanks for having me.
We hope you enjoyed our episode today on CYC MD.